At MedsPLUS Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Bringing the pharmacist back to the community, MedsPLUS Consulting Pharmacy and Wellness Center. Good Monday, everyone. Welcome back to MedsPLUS Medical Minute. I'm Dr. Pauline. In the absence of Dr. Pauline, yes, we do miss her, with your weekly dose of real health information from your community pharmacy. May is Mental Health Awareness Month, and today we're talking about something that does not get enough attention: the role your pharmacist plays in your mental health care. And today I have some extra help. I am joined by two of our pharmacy interns, both completing their first year at Samford University's McWhorter School of Pharmacy. Please welcome William and Dezirae. These two are the future of pharmacy, and today they're going to help us break down something that affects millions of people in our community every single day. So let's get into it. Here's what the data tells us. 1 in 5 Americans experience a mental health condition every single year. But in the Black community, we are less likely to receive help or to seek help, less likely to receive a diagnosis, and less likely to stay on treatment. Some of the reasons could be stigma. We were taught to pray it away, to push through, to keep it moving. But here's what we know now. Mental health conditions are medical conditions, just like diabetes, just like hypertension. They have biological roots and they have treatments that work. And one of the most important and most overlooked members of your mental health care team is standing right inside the pharmacy. This is exactly what we're going to talk about today. So Dezirae, if you'll kick it off for us, talking about mental health medications.
Thank you, Dr. Jennifer. Being in pharmacy school has already taught us how central the pharmacist is to a patient's overall care. And mental health is no exception. Many mental health medications, like antidepressants, mood stabilizers, and anti-anxiety medications, take time to work. We are talking 2 to 4 weeks, sometimes even longer, before a patient feels the full effect. And that waiting period is one of the most critical times because that is when people are most likely to stop taking their medications before it even has a chance to work. The first role of the pharmacist is to make sure you understand your medication. From there, we counsel you on the possible side effects and when it is appropriate to reach out to your pharmacist or your doctor. If you have any questions about your mental health medication, your pharmacist is one of the first people you should call.
Awesome. Thank you so much. So William, if you'll talk about how a pharmacist is an integral part of your care team.
Yeah, thank you, Dr. Campbell. Kind of what I've come to appreciate in pharmacy school is that the healthcare team, or that healthcare in general, just doesn't happen alone. When it comes to mental health, your care team can include a primary care doctor, a therapist, counselor, a psychiatrist, and then, of course, your pharmacist. But here's what makes your pharmacist unique to the team. We see you more consistently than any other provider. We pick up your medications, and that's a touch point. That's an opportunity for us to check in and make sure to ask how you're feeling, how your medication's going, and obviously to notice if anything has changed. Sometimes it's easier to start that conversation with your pharmacist rather than actually booking an appointment with a primary care doctor. And then your pharmacist is a safe space. We're trained, we're discreet, we're accessible. And then we want to be a part of your journey to wellness. And we're not just a person who hands you the bag.
Excellent, excellent. So next we're going to talk about what happens when mental health conditions go untreated or undertreated, because this is where it becomes a physical health crisis. Untreated depression and anxiety have been linked to increased risk of heart disease, high blood pressure, weakened immune system, and poor diabetes control. The mind and the body are not separate. What affects one affects the other. Chronic stress and untreated mental health conditions raise cortisol levels in the body. And over time, that leads to inflammation, weight gain, disrupted sleep, and increased risk of stroke. And yet, in our community, nearly 60% of Black Americans with a mental health condition go without treatment. Not because they don't want help, but possibly due to stigma, access, or nobody told them their pharmacist could help them navigate their mental health journey by referrals or genomic testing. Today, we want you to know your mental health matters, your wholeness matters, and you do not have to navigate this alone. So, if you or someone you know or someone you love is struggling with mental health and has been trying medication after medication without finding what works, we do have an option for you. When it comes to traditional medicine, it's largely been a trial and error approach. A doctor prescribes a medication, you wait weeks to see if it works, and if it doesn't, you start over. In mental health, time is of the essence. The trial and error approach or process can cost someone weeks, sometimes months of unnecessary suffering. At MedsPLUS, we offer pharmacogenomic testing. This is a simple genetic test that helps your doctor select the class of medications most likely to work for you based on your unique genetic makeup. Not a guess, not a trial and error, your genetics guiding your treatment. This is called precision medicine, and it's available right here at MedsPLUS. Ask us about it. Actually, you can go to our website. The link is in the caption for you to be able to learn more about genomic testing and also schedule a consultation. It could change everything for you or someone you love.
Now, if you have any questions, please do not hesitate to reach out to us.
And if nobody's told you today, your mental health matters. Come see us. We are your community pharmacy.
All right. Very good. So, Mental Health Awareness Month, we want to make sure you're aware of genomic testing and how that could also be an opportunity for you on your mental health journey to find the right combination to help you live healthy and whole with your mental health journey. So this week we will have a community event. So I just wanted to share this with you. Let's see, we're actually going to be in Forestdale Senior Center. And okay, it's not letting me add it. That's okay. It won't let me be great. That's all right. Okay, so this Thursday, May 14th at 10:30, we will be at the Forestdale Senior Center, and we'll be talking about hypertension. You know, last week we talked about High Blood Pressure Awareness Month. So we're going to be doing a talk about hypertension and also chronic kidney disease. So if you're in the area or you have time to come by that day, please come by, say hello, and get some information. So thank you for tuning in to today's MedsPLUS Medical Minute. I'm Dr. Jennifer, along with our pharmacy interns, William and Dezirae. We want you to stay well, and we will see you next Monday.
At MedsPLUS Consulting Pharmacy and Wellness Center, results matter. Empower your health journey with a pharmacy that puts you first. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. MedsPLUS Consulting Pharmacy and Wellness Center.